Okay. Assalamu alaikum rahmatullah. Welcome to the IR tips video. So today we are going to demonstrate to you about the stents what we use regularly during the IR procedures. So according to the deployment, we have two types of stent. We have a balloon expandable stents and we have a self-expandable stents. So we are going to demonstrate with the both stents. Okay, let us focus on this one. This is the pre-prepared inflation device. So this is the one we will use for the, in case if it is a balloon expandable stent, we will use this one. So this is already prepared with the half normal saline diluted with the half contrast. So sometimes we will make it more contrast to make a good visibility also. So let us see, this is already loaded and I already primed without any air. So this is ready to use. So if you open a stent, you can see like this. This is the balloon expandable stents and over the wire. Okay. So now you can see I'm going to flush. You have two ports here. One is the straight one, another one is the in the side port. So the straight one is usually for the to insert the wire, and the side one for the inflation device. Okay. So we will be just flushing the straight one. You can see here. Okay, you saw this. Okay, great. So now this is ready. This is also primed. So the next the side port. The side port we will make a small needle or something and just prime this one with the contrast, usually the diluted contrast, just like this, to make it no air to going to the balloon. And after that we will just connect the inflation device onto the side port. Okay, now this is ready. And we have to look at the balloon, the catalog, to see what is the nominal pressure and what is the bursting pressure for the deployment. Usually this is mostly in case of the balloons. For the stents also we have to see the what is the pressure recommended by the company. So now you can see the stent here with me in my hand and also the inflation device. So I'm going to use the inflation device. You can see now how the stent is expanding. You can use the inflation device to deploy. You can see the balloon is inflating and the stent will be deployed. This is one of the covered stent called atrium will be used. So now you can see the balloon is inflated. Okay, now the stent is expanded. Now the stent will fix in the walls of the blood vessels or the whatever the lumen we are using. So now after 30 seconds of time, the physician will ask you to deflate the device. Okay, now you deflate the device completely. Okay, now the stent will be departed already in the blood vessel. This is the mechanism how we will be using. Here we can see that the stent is free to come out. So if it is inside the blood vessel, it stay inside in the blood vessel. We can remove the balloon. Okay, this is the usage of balloon expandable stents. This is one type of balloon expandable. This is the covered stent. You have uncovered stents also. So this is one of the covered stent. Yes. Okay, the second one we are going to see about the self-expandable stents. Okay, the self-expandable stents are once you open the kit, it will be like this. Inside only the sterile. You will take the stent outside. Okay, and okay, now you can see the stent is like this. So over the wire we will load the stent into the vessel with the designated area type, and after that we have a pot here to be flushed. Okay, so before we will just flush this line. Okay, before connecting to the wire. Okay, to see it is flushing, you can see it is dripping this line here. So that means it is already primed. Flushing done, you close the lumen here and remove the saline, and now you will load the wire into this pot and the wire will come out through this area. Okay, now this is ready. Once the physician will place the stent according to the stenosis or the lesion where they want to place the stent. So now this is the deployment. How will be the deployment? You have a pot here. This is here. This is tightened now. you will unlock this one. Okay, like just you will rotate this one anti-clockwise. So now this is loosened. Okay, very simple. You will hold this one in your hand, left hand if you are dominant, and just the other part you will just you will push it. Okay, now you can see how the stent is deploying there. Okay, the stent is deployed. Clear? Now after you go completely, you can see now these two parts are close together. You will remove this system over the wire. So now your stent is deployed in the blood vessel. You can see this is an uncovered vascular peripheral stent inside the blood vessel. Thank you very much for watching the video. If you have any doubts, please contact us and we will solve all the questions. Thank you very much.